Dr. Bhatia, can you go on and tell us a little bit why is the relapse for skin cancer at 40 to 70%? That was an amazing statistic.
This was not skin cancer, this was melanoma.
Though we're the melanomas.
Melanoma.
Okay, so
And we were talking specifically about high-risk melanomas. And most patients with melanoma are going to be fine and probably do not need more care. And that is offered by the dermatologist. In patients in whom the melanoma is more than 1 millimeter in thickness, they will usually land up seeing a plastic surgeon in order to consider a more complete surgery along with assessment of lymph nodes to see if there's cancer in the lymph nodes. The patients that medical oncologists see are few. They probably represent less than 10 to 20% of the population of patients with melanoma. The statistics that I quoted are for high-risk melanoma, which is essentially patients in whom, after the plastic surgeon has operated on them, they found that there is involvement of the lymph node, or the tumor is more than 4 millimeters in thickness. So it's a very enriched population that I see. Most patients will see a dermatologist and a plastic surgeon.
Dr. Young, would you like to add to that in terms of how prevalent this particular cancer is?
Well, I think melanoma touches many people's lives, and unfortunately it's much more common than we'd like to see it. I think Dr. Bhatia I completely agree with him. I mean, the reality is that the good news is most people have very early stage melanoma, and it's very easily resectable with simple surgery, and they go on to do very well and lead full lives.
This question is to both of you. From your point of view, what's the number one thing that I can do to prevent skin cancer? Dr. Young?
I got one word: sunscreen.
Same.
Same word, sunscreen. Okay, thank you very much.
I think family members need to be aware that a lot of the issues with skin damage start in childhood, and I cannot stress how important it is that prevention starts at childhood.
I think most of the reading, if you do in the literature, suggests that an average person's sun damage is obtained before the age of 18. So when most adults become aware and start using sunscreen, the reality is it's probably a little too late.
I think one needs to be aware about the dangers of tanning booths. I know this has recently been in the news. There is definitely a case to be made against tanning for tanning's sake.
Let's go one step further and understand we're in the direct sunlight, we're in the tanning booth. How is that different?
Well, I mean, I think a lot of patients think that, they're going to be in the tanning booth bed for a few minutes and that it certainly can't create too much damage. But a tanning booth bed delivers ultraviolet radiation in a much more intense fashion than sunlight. The same damage that might occur over hours can occur in minutes. And the DNA in your cells does not have time to adjust and protect itself. So a tanning booth bed, the damage you do in a tanning booth bed in minutes is so much significantly worse than, being outdoors.